Welcome and thank you for joining us for Cynosure University. Today we're joined by Dr. Regina Fairmonti, microvascular fellowship-trained plastic and reconstructive surgeon. Dr. Fairmonti is the medical director of Skin at Elan and Restore Men's Health in San Antonio, Texas. Before we get started, let me just review a few housekeeping items. Throughout the presentation, we encourage everyone to submit questions using the Q&A feature located on your dashboard. We receive many great questions during our webinars. As time permits, we hope to have all of your questions answered live, but if we don't get a chance to get to them, we will be following up personally with you. Also, this educational session is being recorded and will be available for review on our website. One more thing, be sure to download the handout associated with this webinar today. We have a lot of practice-changing information to hear about today, so let's get started. Thank you and welcome to the call, Dr. Fairmonti.
Thanks for having me and good afternoon from San Antonio, Texas. Hope everybody's staying safe.
We're doing great. You're good to get going with the program today. Thank you so much.
We're advancing that slide. So today I'm going to be talking about my experience with radiofrequency in my practice. As a plastic surgeon, I'd say for a large part of my career, I ignored the non-surgical aspect. And not having a radiofrequency platform, I found, was really a detriment, and I was losing out on a patient population. So I wanted to share with you some of my pearls and some of the technology I've adopted. So why? I think that's a good question. When you're looking at acquiring new technology, why would you acquire it? Looking back in 2019, and this is ringing true in 2020, the top 5 procedures I have been asked to perform in clinic that are outside of the OR are non-surgical rhinoplasty, chin and jawline augmentation. Submental adiposity is a big topic, and this jaw definition in both men and women is something we see atrophy with aging. We really want more defined. Fat reduction, skin tightening is probably a number 2, and with that, cellulite and stretch marks, which are the bane of probably any surgeon's existence, because there really hasn't been a good treatment for cellulite, but it's really over 80% of the population suffers from this. Liquid facelifts are number 4, and then a customized skincare line is number 5. I find as patients are younger, they're asking for a more customized approach. It's not a cookbook approach anymore, but they want to know what would be best with their skin type and their skin condition. So 70% of consumers are looking for non-invasive treatment. So to not address these non-invasive treatments in your practice and have a platform that can treat all of them, you are missing out on that possible revenue stream. The top 5 procedures performed really have to do with skin tightening and addressing rhytids or facial aging signs. And 74% of patients, in fact, are concerned about the crow's feet or the periocular rhytids, with I would say perioral rhytids being number 2. So it's a real concern for patients, and I really say up until recently hasn't really been paid much attention to. So this is from the American Society of Plastic Surgery website. They update their data, really they're about a year behind, but you can see trends in the last decade since 2000, and then we stop at 2018. And you'll see over here, some of these, in 2000, some of these treatments just had an asterisk. These weren't really being captured because they weren't really something to talk about with a good treatment. But non-invasive fat reduction with the advent of sculpture and other non-invasive technologies in the market is something that's really gaining momentum, as well as non-surgical skin tightening with radiofrequency. Cellulite treatment as well. Again, a blip on the radar, about a 55% increase since 2018. So that's real. And then I would add sclerotherapy or treatment of facial veins is something else that patients are asking for. Why my patients come to see me and they're looking, what are they looking for during that in-clinic non-invasive procedure? Well, cellulite, I think of the buttocks and thighs, in addition to moderate to mild wrinkles of the face and the submental area are 2 of the biggest concerns. A lot of younger patients are looking to be proactive. So rather than treating a patient in their 60s or 70s that has really a significant collagen loss, a lot of my 20 and 30 somethings are looking to preserve and maintain. So that's kind of a different feature we're seeing as of recently. I have surgical patients that have had previous rhytidectomies or other procedures where they still have a poor skin quality. Liposuction doesn't always address skin quality. So to have an adjunct to treat them and to maintain or preserve, or even I would say augment their results, is something I have found useful in my practice. Unwanted skin changes after weight loss pregnancy. just desiring firmer skin overall, making up for the collagen loss that we see that starts to occur in our 20s. And a lot of my patients aren't willing to undergo a more invasive or surgical procedure. They're not medical candidates or they don't desire to do so. So having something to offer them in clinic is something that has really been beneficial. So Tempture is the platform I'm discussing today. I've had my device for over a year and a half, and radio frequency isn't new, but the Tempture delivery system is something that has the unique qualities that makes it innovative. It's a 300-watt device with a 10-inch touch screen, very easy to operate, very intuitive and user-friendly. It's 4 megahertz monopolar delivery system, so patients do require a grounding pad, and it allows non-invasive aesthetic treatments as well as has surgical capabilities in a very expandable platform. So it's something that doesn't take up a lot of space, and I would find in my office has multiple uses. So multiple applications in this single platform. On the left is your Tempture Envy. Those are your smaller hand pieces, and those are reduced facial lines and wrinkles. And the mechanism of action is soft tissue coagulation. So I guess remembering back to science class, you heat the collagen, you cause some collagen fibrils to denature and they contract. It also stimulates collagenesis. So that's the mechanism of action we're speaking of. We have larger hand pieces, and this is your Tempture Firm with these attachment for cellulite. And moving on down, Tempture Surgical is this whole expandable surgical platform. And so it's monopolar cautery with various attachments that expand all the way from dermatologic procedures, plastic procedures, oculoplastics, and gynecologic procedures. And then there's the Tempture Vitalia hand pieces for women's wellness. So it's a device or a tool to put in your toolkit to really expand your armamentarium of the procedures you can offer your patients. So here's how it works. This is just kind of an analogy of what actually happens to the energy and heat delivery. So you can see this is an ex vivo, so an abdominoplasty specimen placed on top of this patient, and this is the hand piece, and it's measuring through temperature sensors the temperature that's delivered to this piece of tissue. And you can see with the red representing 42, 43 degrees, which is a therapeutic range, you can see that it's pretty uniform and diffuse. It's circular motions that you're actually operating this device over the tissue, and you can see that it actually reaches that temperature and maintains that temperature in the entire area being treated. That temperature sensor that's in the hand pieces is also incredibly sensitive. In fact, 100 times faster feedback to the operator than the competition, meaning treating the patient, you have felt the tissue up to 42 degrees and you're getting feedback on the monitor that you're actually at that temperature. It's so precise that taking it off and placing it on ice, immediately you see a drop in that temperature. So the feedback is very important. You reach the temperature desired, and it's accurate in the sense that you're actually maintaining that temperature. And that's very important. You want to make sure the patient's getting the treatment that you're prescribing. I would say consistent treatment as well as you're adequately treating them. So it doesn't allow you to not do that, in fact. So this is what the LED looks like, and the technology is called the Therapeutic Logic Control, or TLC, so it really does take the guesswork out and makes this less operator dependent, which I think is very important. You can see a couple things on this monitor, and this is the NV screen. This gives you the power left in your handpiece. This gives you the temperature or target temperature that you've set the temperature at to get your therapeutic benefit, usually 39 to 42 degrees. Here's the interval in the treatment and the total elapsed time. Let me show you that in a little more detail here. So you have an interval timer. So this is the timer that does not start counting down or start the treatment till you've reached 39 degrees at least. So setting it at 39 degrees, it does not start clicking until we've hit 39 degrees. So you may, I say there's probably about a 2-minute buildup time. So it takes about 2 minutes or so, depending on the surface area treated, to get to that 39 degrees. But the clock doesn't start ticking for your treatment until you've at least reached 39 degrees. So you're not cheating the patient out you're not cheating the patient out of any treatment, but rather it does not let you undertreat, if that makes sense. Here's what it looks like. This target temp is set 44 degrees. You can see we've had 20 minutes of treatment here, and it varies within about around 2 degrees during the treatment at times. And then it shuts off when I finish with the treatment. So again, it's reproducible results between treatments in the same patient, as well as with all your patients. So this is the Tempture Envy. As I mentioned, these are the 3 smaller hand pieces. You have a 10, a 15, and a 20 milliliter hand piece. And they all latch onto the machine. Here are your Envy components, and here are your Firm components. And here's how it works.
The Tempture Envy treatment is a gentle way to revive skin's natural beauty and reduce the appearance of facial wrinkles and fine lines. Treatment begins as a gel is applied to the skin. Radio frequency energy is delivered, and the device massages the skin in small circular motions. Tissue resistance to RF energy at the dermal-subdermal junction causes an increase in temperature. This temperature is modulated by the temperature system to safely maintain the skin at appropriate levels. As the skin temperature increases during the procedure, collagen is stimulated and mild edema occurs. Once the procedure is complete, the skin temperature drops back to normal. Facial wrinkles may seem less visible for 2 to 3 days after treatment. At 7 to 10 days post-treatment, the rebuilding process begins on the dermis. Fibroblasts accumulate to synthesize new collagen and elastin. Tissue growth factors are released. At 25 to 30 days post-treatment, new collagen and elastin synthesis decreases fine lines and wrinkles. Temperature Envy, beautifully intelligent RF technology.
So I think that slide really illustrates where the treatment is. Again, it's at that dermal-subdermal junction. I know some other technologies go a little bit deeper, which in my opinion cause a lot more pain and discomfort. So what's really important is patients are very comfortable. The analogy is it's like a hot stone massage, so very relaxing. The device plays these therapeutic spot tones that you can change and treat, with a variety of tones. But it really is a spa atmosphere type treatment. What's really important, I feel, is there's no downtime. I will show you a couple pictures, but there is some edema that lasts about a day or two, and a little bit of hyperemia, but that subsides. And after treatment that evening, the patient can go to dinner and really looks very good. There's no downtime. You can do this procedure. This is radio frequency. This is not a laser. So any time of year. So we're approaching the summer months when the pandemic lifts, and so patients that have been in the sun, patient with Fitzpatrick 4, 5, 6s, there really is no patient you can't treat with this, which makes this really a valuable asset for your estheticians or yourself to use year long. 96% patient satisfaction. And again, I think that really relates to the fact that it's painless. I would say relatively painless. I don't use any topical anesthetic. I don't use any oral medication pre-treatment because you do want that patient feedback, which again, in my experience, has been very good. Full face takes about 48 minutes, and with the larger handpiece with the firm, shorter times with the body than 1 hour. And here's some results. I do like to show an immediate post-treatment to kind of show you that edema and hyperemia, but this is treatment of the periocular area. So again, remember the mechanism of action is soft tissue coagulation. What I'm doing is adding heat and tightening, and you can see some immediate improvements. You do see some hyperemia and edema, but her eye looks more open, more awake. Question, I think a good question to always ask is, okay, everyone looks great after a small sunburn or a little bit of edema. Am I really getting a treatment effect? So typically I offer patients 4 to 6 treatments about 2 weeks apart to get optimal results. And I follow them with pre and post treatment pictures. So here is our baseline. Here is after that treatment I just showed you immediately after. And then here is this is 2 weeks after the 4th treatment. So this is not immediately following a treatment. So going back to our baseline picture and post 4th treatment picture, you can see what appears to be some improvement in this periodontitis. But more importantly, notice her eye looks more open. Look at the position of her brow and some of this excess skin. There really is an improvement. And it's long-lived. It's not just from edema and hyperemia. Here's before and after 6 treatments. And again, this is approximately 2 weeks after her 6th treatment. And this was periocular and peroral. So you can see nasolabial fold. And again, eye looks more open and some smoothing of the periocular. So those are the 3 smaller handpieces. Temperature Firm is your 25, 30, and 60 millimeter handpiece. And this is for treatment of the body. So 3 handpieces. These are quicker treatments because, again, you have a larger handpiece to deliver the energy quicker. 96% of patients are described as comfortable. I'd say just as comfortable as the face. And again, it's all skin types, all times of the year, regardless of those summer months. And this is the attachment for cellulite, which you can see works really well in the buttocks. So here's an example. I showed you some of those temperature sensors and how you can reach 1 and 2, maintain that temperature for the entire treatment. So you're getting consistent results, but it also does not allow you to get any hot spots or burns. And I would say that would translate into pain for the patient. So it makes it more comfortable. Let's see how this works. So again, it's that 2-minute build time to reach that therapeutic temperature that you've set your target of 42 degrees. It is diffusely reached in that tissue. And again, no hot spots, no burns.
Here's
patient comfort, high patient satisfaction.
Again, maybe the goal is
Here's
to
a couple
firm
patients
skin.
that I've treated.
Male
Male
patients
patients
always
always
challenging,
challenging, but this periumbilical
male
donut is
patients
always an
always
area of
challenging,
concern.
but this
And the
periumbilical donut
pectoralis
is
or
an
chest
area
wall
of
region.
concern.
This gentleman actually has had a surgical procedure to remove some gynecomastia, which doesn't always address the skin. So this is a gentleman before and after 2 treatments of the abdomen and pectoralis or chest region. You can see more definition, and something I've noticed too, I always look at the umbilicus because that's kind of when you see the effect. You see kind of this more open looking umbilicus. You kind of get this more aesthetic looking umbilicus, and that's something, or in that periumbilical donut as we call it, that's very desirable aesthetically. Another example, again, there's been no weight loss between these patients before and after 4 treatments, and you can kind of see some improvement in that periumbilical donut. And again, here, this gentleman was treated in the abdomen, and in these the flank region, the lower abdominal region, you can see some improvement in overall contour. Female patients have some similar concerns. The periumbilical region as well is always concerning. And then women have this posterior bra roll, which is also concerning. I treat patients surgically, and I use tumescent liposuction in the operating room. That I do not promise ever treat cellulite, nor would I ever promise that it firms skin. So to have something else that I can offer my patients, I have found in my practice, in my experience, that this is a great adjunct to that. So seeing patients after even a surgical procedure or without a surgical procedure. Here's another example, and you can see an improvement in her contour. So we talked about cellulite. This is the cellulite attachment. So we call it 5-minute thighs. That was a marketing campaign we had with the caveat that there's about a 2-minute buildup to reach temperature. We're doing this in the procedure room. There's my esthetician, Sylvia, who's performing most of these. And you can see I'm in my buildup time, so I haven't quite hit my therapeutic or target temp yet. But when I hit 39 degrees, this clock will start to make sure I deliver a consistent treatment, again, in a therapeutic range. It doesn't let the operator cheat. So you make sure you're guaranteeing that patient an adequate treatment. Talking about the edema and hyperemia you see after. So this is before, this is immediately after. And again, I show you some of the edema and hyperemia. And patients do appreciate that because they walk out looking better. But that's short-lived. No downtime. Usually by later that night or in the morning, that redness and edema has subsided. And here we are about a week after. And again, this is only one treatment. I mentioned I stack these an average of 4 to 6 treatments 2 weeks apart, but you can already see some improvement. And again, there really is no great treatments for cellulite. There's nothing I would ever promise patients, but to have an improvement like this is pretty remarkable. And I'd say it correlates to very high patient satisfaction. Another example, the lower thigh / upper knee skin always can use some help, especially with aging and collagen loss. So again, by the same mechanism, we see this overall improvement. And again, I'm at a little improvement here. Again, it's something that's very well appreciated by your patients. So that's the envy and the firm. So I have used for an in-office device to do minor procedures. A lot of us remove lumps and bumps, take care of paronychias, moles. So to have a platform that I have a different channel that I can plug this handpiece into that allows me cautery, fulguration, and coagulation capabilities is wonderful. I have a very small procedure room, so to have a device that can be used by multiple operators almost every day of the week for different purposes is not only economical from a financial standpoint, but from a space standpoint. So when I am not when my esthetician is not using the NV and the firm for soft tissue coagulation, and I can actually plug the cautery device in for monopolar cautery delivery. So it's using every bit of space in my room and making sure my devices are achieving their maximal earning potential. So here's the same LED screen. I just click on the surgical, so exactly the same monitor. What kind of things am I doing and why? Well, again, if patients don't have to go to an operating suite and pay a facility fee, it's beneficial. Things that I can do in my clinic are eyelid surgery, labiaplasties, and then some non-surgical body contouring. Not to mention lumps and bumps, mole biopsies, and buccal fat pad reduction is something else I've been asked to do. These are growing trends, as you can see, cosmetic surgical procedures with eyelid surgery and any body contouring procedure really being high on the list of what patients are demanding from our plasticsurgery.org website. So what have I used previously, or what do most of us have in our procedure rooms? Well, there's an ocular cautery. This is straight up just high temperature. I use this now to bovie nipple templates and to cut suture material. A lot of heat this produces. Moving on to this other device, this handheld cautery unit, which ranges from, mine is actually 470 kilohertz. So that cycles per second, which means it emits a lot of heat. And a lot of heat translates possibly into patient discomfort, but I would say translates mostly into a collateral soft tissue injury from the thermal injury. So if I have something that can actually not spark, not emit a flame, and really target the energy to where I want it to cut and coagulate and not cause a lot of collateral trauma, that's beneficial for my patients, especially when I'm performing these procedures in aesthetically sensitive areas. So less tissue damage, we think maybe also correlates with better healing and ideally a better scar and cosmetic result. So the analogy of frequency, again, most of our handheld units are around 470 kilohertz. This is a 4 megahertz. So that's millions as opposed to thousands when it comes to frequency. And the analogy to its cutting potential, what it does to surrounding tissue, is I think really summed up by this analogy. Your lower 400 kilohertz device leads to a lot of splintering, a lot of collateral damage when it cuts that plug in half. Whereas a higher, a millionth of a frequency device leads to a much cleaner cut, less collateral tissue damage, less trauma, less edema. Here's an example. These are probably familiar handheld units that you've seen in your office, and you can see the charring effect that occurs versus a much cleaner cut without a lot of this kind of brown charring, burning of the tissue, and that's with your 4 megahertz device or your temperature surgical device. We have scalpels. How do these compare to cold surgical steel, which is, in my opinion, the gold standard? Well, here's my standard 400. This is electron microscopy, so looking at things a little bit closer, you can see that there is some disarray of the fibers here using an electron microscopy device to visualize them versus my temperature surgical. But looking then at a surgical scalpel blade, so cutting the tissue, no heat with a scalpel, you can see that there also is some disorderly array of those fibrils. So meaning I can get a more precise cut with perhaps less trauma with this device than I can with using a scalpel alone. Translate that to procedures on the eyelids, face, back, and neck. You really are optimizing potentially your aesthetic outcome. So we have precise incisions. We have an array of tips we can use, everything from a hook to a fine needle. Minimal scar tissue, faster recovery, and a more improved result with a better overall patient experience. So looking at one of the most delicate areas of the face, the upper eyelids, a blepharoplasty is a surgery to perform. Your eyelid skin's about 1 millimeter thick, so I can't think of a more sensitive place to perform such a procedure. I do perform upper eyelid surgery or blepharoplasty in my procedure room using the temperature surgical. I don't use an eye shield or corneal protector. This is the minimal supplies that I need to do it. I usually use a 6-0 Perlene or nylon pull-out suture. Basically a surgical pickup, some local anesthetic. I set my device to 30 and 30, or 29 and 30 if you want to be fancy, using the cut, and then I can go back and use the coag, and here she is with anesthetic injected, immediately post with the specimens removed, all awake, just local anesthetic. And you can see immediately after, this is probably this is your redheaded patient on aspirin, if you would say. So prone to a little bit of bruising, but you can see very well tolerated. This is just 3 days post-treatment. Actually removed a cyst as well too under local at the same time through that upper eyelid incision, but you can see very nice results and very clean suture lines. This area traditionally does heal very well, but swelling and downtime, if you can imagine, especially with upper eyelids, it's not very well tolerated. People want to get back to work quickly. So again, that is almost an imperceptible incision. Buccal fat reduction is something I'm being asked to do more and more. This is a device that I use with the coagulation and the cut with my Temperature Surgical. The idea of this is you're reducing the buccal fat pad to help improve facial contour. Popular in women and men as well. Or again, we're talking about contouring the submental region. That's a very hot topic. So again, anything we can do to tighten this region with coagulation and remove some fat pads, we're getting a better result. And here's how that works. And you can see it's an intraoral incision under local. I've identified the duct of the parotid gland, and I'm staying away from it. I'm by the maxillary molar, tugging it out. This gentleman's completely awake. We just have used local anesthetic, and there it is. I switch from the cut to the coag to amputate the specimen, and there we go. So there's a buccal fat pad reduction. Other obs-based procedures, well, everything from blepharoplasty to mole excisions and lesions, treatment of rhinophyma. The hook tip that I showed you with coag is very nice to debulk a nose of a patient that suffers from rhinophyma. Facial veins, everything from cervical biopsies, eyelids, cyst removal, and brow lifts to a lot of the turbinate reduction pupilloplasty we see with our ENT colleagues. The cosmetic package that comes with the Temperature Surgical includes all of these tips that I just showed you. It also comes with this very nice needle tip and trichiasis and dystichiasis. This basically means your eyelid, on your upper lid, your eyelashes go inward, can cause a lot of corneal abrasions. The alternative to actually having a heat-based device that actually ablates the hair exit and causes the hair to be permanently removed is everything from cooling and just epilation, actually physically pulling out the lashes. That leads to a lot of pain and ingrown hairs, so not very well tolerated. Even if you look at some of the other devices available, I've even seen freezing the lashes to cause damage to the hair bulb so it doesn't regrow. A lot of swelling and downtime, so not very well tolerated. This is a difficult word to pronounce without 2 cups of coffee. Dystichiasis. This is actually double eyelids, so people sometimes have two rows of eyelashes. It can be congenital or traumatic. This is also very painful and difficult to treat. This device, putting the needle tip right into the hair follicle, you can actually ablate it permanently. So it's really nice. Telangiectasias as well, or superficial facial veins is something else we treat. Sclerotherapy is not good for the face, but small facial veins around the nose or at the base of the nose, again, using a very tiny microincident needle is also a very nice trick. And let me show you how that works.
Temperature telangiectasia treatment with the Cosmetic pen, the non-invasive treatment method. Facial telangiectasia may be treated without puncturing the skin. Using the coag mode, set the energy level at 3. Depress the foot pedal before beginning, keeping it depressed, and treat the telangiectasia distal to proximal. Tap the tissue adjacent to the vessel about every 1 to 2 millimeters. If blanching of the vessel does not occur, turn the energy to 4 and repeat. Once the vessel blanches or disappears, the treatment is successful. For stubborn facial telangiectasia, use settings 1 through 3 on coag. Begin at an energy level of 2, and if blanching doesn't occur, the energy may be turned up to 3. Pierce the skin adjacent to the vessel every 1 to 2 millimeters. Avoid piercing the vessel, as that will cause bleeding and bruising. The vessel is coagulated if it blanches.
So again, starting at the lowest energy possible, which is 1 to 3 for facial veins, is the trick, starting distal to proximal. And I would say it usually takes about 2 to 3 treatments. You will see the vessel disappear, and the patients are, oh my God. But do say have them come back at maybe 3 to 4 week intervals. There's some collateralization, especially at the base of the nose. So I'd offer them maybe 2 to 3 treatments. Something else that I think all providers can relate to is lumps and bumps, skin tags, moles. So again, we're going to do a biopsy on any suspicious lesions, but skin tags are something that really, I don't know why this is so interesting in the general population, but everybody's got them. We did a little video on TikTok of a skin tag excision, and we have built to 13.1 million followers, and I got 4 phone calls for skin tag excision that day. So patients like this. And there it is, using the phone. So it gets people in the door. They come for their mole or skin tag excision, and they stay for a body contouring procedure. So it's a nice way to recruit patients because everybody's got lumps and bumps. Here's how that works. Here's actually using the hook device. And again, if it's something that's not macular but raised, you can grab it, you can lasso it, and then you can excise it using a different tip to kind of saucerize or shoulder the edges so that you don't have any depressions. I think specifically the tip of the nose where you have thicker skin and other areas like that, you're going to want to saucerize or show the edges. But you can see even in these very cosmetically sensitive areas, you're going to put a very nice result, a very aesthetically pleasing scar. Another example in the preauricular area, raised lesions, again, work well with that loop, that lasso, and you actually get a very nice aesthetic contour. Seborrheic keratoses, probably number 2 to skin tags. If they're raised, you can treat them the same way, excise them, make sure you don't have any depressions or raised areas, and then you can get a very nice result. Dermatosis papulosa nigra is another condition we see. There are lasers to treat this, and I'm going to jump ahead and show you, but lasers do not completely eradicate it. So patients don't want any pigmentation changes, even though you got rid of some of the texture, may not be tolerated by actually physically removing this with the hook. Minimal tissue trauma means less pigmentary changes post-procedure, especially in this periocular area, is something very well appreciated by patients. Milia is something I see. These miliary cysts, if you recall, are keratin plugs. Primarily, you see them in babies, but we get a lot of secondary milia here in South Texas from sun exposure, post-ablative laser treatments, and minor trauma, poison ivy, you name it, or long-term steroid use. Traditionally, my esthetician would use her extractor and try to remove them using maybe an 18 gauge to make a little nick in the skin and express it. It's not very pleasing to the patient. There also might be a little bit of bruising and downtime. Again, I start with the lowest settings possible, and this is something I do let my esthetician do. In Texas, I can delegate anything that I see fit. My esthetician is a laser professional, but again, this is a radio frequency device, so you don't have to be a laser professional in Texas. But I delegate this as well as spider veins and telangiectasias to her, and she's had amazing results, very improved patient experience as well. So again, I set at the lowest settings possible, and basically without any numbing, she's doing a setting of 2 coag here, makes a small nick and uses her extraction tool, and it removes the keratin plug. This is this patient immediately post-treatment. Some of these smaller miliary cysts that maybe you can't actually express or that keratin plug from, she's also just using a 1 or 2 on the cut or coag setting. I would say almost fulgurated it, and it hasn't returned. So it's been really nice. And again, I'd probably promise patient 1 or 2 sessions with this too, just to make sure you have eradicated the problem. So our takeaways from the surgical quick recovery, less collateral tissue damage means less patient trauma, less tissue trauma, perhaps less pigmentary changes and better scars. We can cut and coagulate with 1 instrument, and that's the same instrument that I can use for my firm and my NB, if you recall. So I am maximizing space in my procedure room and maximizing my return of investment, which overall translates into an overall more complete spa experience for my patients. How I price these things and stack them were for ablative lesions, things that really take me no time at all. Again, with that loop, I charge $250 for the first and $150 for each additional because they're laying there. I'm prepping it. Takes less than 30 minutes, so it's actually a really good return of investment. Excisional, I do include pathology fees if it's something I'm concerned about. So any indeterminate lesion or pigmented lesion or anything that's maybe macular and that I may have to sew, I do charge a little bit more. And then I add a scar care package too. Again, we have some other platforms in our office. I actually have an Icon laser platform, so we do add a scar treatment package with a few sessions of that in between in cosmetically sensitive areas or maybe a darkly pigmented patient. How I sell my NV and firm treatments. Well, we actually have a sculpture device for non-surgical body contouring or warm sculpting, and we actually add this on now with the larger hand pieces. It really takes no time for my esthetician, especially in that perivigal region. We're stacking these treatments with the sculpture in the sense that we're doing a sculpture session every 6 weeks, and at 3 weeks they're coming back in between for their temperature session. So it's kind of like a sculpture sandwich with temperature surrounding it. So I'm getting the fat reduction component. Buy 2 areas of sculpture, they can get firm 50% off is a way to package it. A shrink and tone monthly membership has been beneficial too. We have the patient buy a package and additional treatments are discounted. So that's been actually something that they love. Submental sculpture, again, this is a hot region. I'm actually doing jawline filler, submental sculpture to get rid of this. and then NB to actually help with the coagulation of this region to help improve that contour is something that's been really also well received. How I'm doing the filler, or how I'm approaching that, is I don't heat up my filler, but they can actually have their NB treatment followed by, on the same day, filler to the jawline to augment that ramus in that jawline. I don't do filler and then a heat-based therapy because I don't want to heat on my filler. But having warmer tissue, especially some with your biostimulatory fillers, I've actually really liked the way the filler has actually gone in with that tissue being warmed up by the temperature ahead of time. Blepharoplasty and then NV of the periocular area, something that there really hasn't been much to address until then. Tear trap filler, NV and toxin, and then this barcode, these vertical lip lines are something that's also getting a lot of attention. Your dentist tells you to use a straw so you don't stain your teeth, but you're getting these perioral rhytids. So these vertical lines, I'm actually doing temperature NV treatments of this region and then going in with a low G prime filler to fill these vertical rhytids. And that's actually been packaged very nicely and sold well. So in summary, this is a versatile platform. I can delegate to team members here. When I was looking for a radio frequency device, I wanted something that could be used by other providers and clinicians in my office that were not me, that did not require me performing any kind of a nerve block, nor my direct hands-on in the office supervision. So my esthetician performs temperature and NV treatments as well as sculpture. She's also doing telangiectasias and miliaris. So that is something that is a good return on investment when I'm not in the operating room or I'm doing another procedure. So she can function independently in Texas. Almost every patient can benefit from some application year-round, all skin types, and that's really important in the summer when our laser sales are a bit slower. And this makes it a very profitable technology for me. So I've actually really enjoyed integrating this in my practice. So those are the devices. I want to add, Cynosure has a lot of excellent online tutorials and videos as well, and some marketing material too. And so it's definitely something I invite you to review because we've actually really enjoyed actually starting some campaigns based upon some of the input.
Okay, thank you. Thank you so much, Dr. Faramonte. That was some really great information for our customers today. Just want to remind everybody we have some upcoming events that are going to be awesome. We have Dr. Pablo Boyexeta from Madrid, and he's going to be discussing PicoSure and some skin pigmentary conditions for treating. And then also on Wednesday, April 29th, we're going to have Dr. La Follette from discussing practice of medicine and the profit of aesthetics, which everybody loves that. So that's going to be a great talk for us. Thank you so much for letting me plug those future events. So let's talk about you. Let's talk about what we've learned today and get to some of our questions from our audience. I'm just going to start with first question here. It's pretty simple. You talked about your temperature device in your practice and that you use it for RF with your estheticians and so forth. Tell us again what you're using it for all week long and about how many times a week are you using it with the other devices?
Yeah, we operate Monday through Saturdays, alternating Saturdays, and I would say Monday through Friday during our spa days, our esthetician is using it for some form of body or facial soft tissue coagulation. So every day that device is on. I do have 2 half days that I perform in-office procedures, and that's when she's doing sculpture. She's using our Pico, doing something else, facials. I'm using it for my in-office procedures. Any mole excisions like I talked about, buccal fat pad reductions, revising any dog ears. I do breast reconstructive surgery as well, so I create nipples and do other crazy things like that. So really it's something that we keep it plugged in and we keep it on. So really full capacity.
Okay, getting lots of use. That's wonderful. So I have a customer here asking about pre-warming of the skin. Do you do that? Do you use a hot towel on the skin, or what's your method?
Yeah, so that's actually a great question. If you think about it, I just told you there's a build time for the NV and the firm of about 2 minutes. You want to get that 39-degree range so you can start treating and start the clock. You can. We actually don't, you may not want the AC on full blast, especially if you're in a colder climate. It's always hot here in Texas, so that's not a problem. But a patient that's a cooler ambient room, I would say it's going to take a minute to heat that skin up. So you can place a warm towel on the skin to pre-treat. You sure can, making it more of a spa experience, especially on the face. We usually start with a facial, a warm towel, and then we perform the temperature NV treatment. So in a sense, we are warming the skin. That may help you get to therapeutic temperature quicker. So I think that's a great idea. Yes.
Okay, it sounds amazing. A warm towel on the face, who wouldn't want that? And then, so I have a question here coming in. What settings do you use for the different areas? I guess they mean the different areas of the face versus the body. And is there any variation based on age or skin type or degree of skin laxity in terms of the temperature you're choosing?
Mm-hmm. Yeah, so great question. I'm going to answer the latter part first, if that's okay. So, you know, all skin types all year long, and I'd say different degrees, different needs can be treated with obviously differing results. So my 20 or 30 something that just really wants to improve some five lines around her eyes or her mouth, I'm using usually a 10 or 15 hand piece, but I will tell you that we still offer everybody about 4 treatments about 2 weeks apart. I'm going to have a different the mechanism we've talked about with the soft tissue coagulation is it stimulates collagenesis, right? Heats up those collagen fibrils, denatures them, and you get them laid down like that video that I showed as a demonstration. So in a young patient and an older patient, you're going to get that. But collagen stimulation properties, as you imagine, in a 70-year-old are somewhat different than a 20-year-old. So I think everybody sees some improvement, but how drastic that improvement is really depends on a lot of other factors too. With your older patient, still seeing a wonderful result, but you're not going to get the same results in a 20-something with a different baseline collagenesis mechanism and than an older patient. I use really the largest probe possible or handpiece possible to treat the area. So around the eyes at 10 to 15. If you remember the video, it's small little concentric circles. So you want to, I'd say I don't treat an area on the face larger than my palm because you want to keep going over that area again to make sure you're keeping it at that, maintaining, reaching, and keeping it at that target temperature for the entire treatment time. So probably the 10 or 15 is probably what I use the most, using maybe the 20 down here on the submental area. But that answers the question.
Yes, thank you. Thank you so much. Okay, so an attendee is asking about an earlier slide that you showed of the treatment of a full face, and it was at 48 minutes. Was that the elapsed treatment time, or was the 48 minutes? I think what they're asking here is, did it take 48 minutes to complete the entire process, or how can you speak to that slide again? They're looking for a little clarity there.
Yeah. So how long does it take? Well, you're kind of breaking, again, you're breaking the face up into areas that are probably each about the size of my palm, because again, you're treating the periocular area, the left periocular area, and then, you know, kind of the suprabrow region. And then if you're moving down to the peroral area, you're breaking it up because you want to focus on one area, get it to temperature, finish that treatment, and move on to the next. So depending how you do it, I would say a typical full face takes my esthetician, I would say it probably takes about 40 minutes because we go in, we do a facial. Again, we make it a pleasurable experience in our treatment room. But she's focusing, you know, one area at a time. So cumulatively, probably about 40 minutes. But mind you, we're selling a package of this 4 to 6 sessions. You don't have to treat the full face in one day. You could treat the eyes, have them come back in 2 weeks and do it. You know, these are members, so they're coming to my office frequently because they're part of this, you know, this Tighten and Tone package. So, you know, it could take 40 minutes if you're going to treat the entire face, but that's the reason you're breaking it up into segments. So I think probably 30 to 40 minutes is probably more accurate.
Okay, thank you. So this leads me into the next 2 questions which came in. Customers asking, did I understand you just say that when you do the temperature on the face, that it's a 4 to 6 treatment 2 weeks apart? And then also another question is asking for you to sort of talk a little bit more on your Shrink and Tone membership. So maybe the 2 of those together, we can get one. Okay.
Yeah, that's great. So I never sell one laser treatment. I never sell one unit of Botox. And I'd say with radiofrequency, I never sell one treatment. I will tell you with the edema and hyperemia, everyone leaves her looking better. And they're like, oh my God. But as we talked about, you know, 7 to 10 days is when things are kind of starting to happen. With about a month later, you're actually seeing some of those deeper dermal subdermal junction microscopic changes. With that said, 4 to 6 treatments, and I'd say at a minimum of 3 treatments is what I recommend to actually obtain the results that we're looking for. The membership, this does tie into that, because once we have achieved the results that we like, the next thing is maintaining it. What the analogy is, if you go to the gym every day and you get the body that you've always wanted, and then you take a year off, it's not going to stay. It's not going to be maintained. So those patients are coming in every 6 months then for an additional treatment. And part of the membership program is additional treatments are discounted if they bought the initial package. So that's where the membership comes in. I'm seeing them more frequently to make sure we're maintaining the results, which are permanent, that we've achieved with those 4 to 6 treatments 2 weeks apart. And the membership gets them coming back to make sure we're maintaining.
Yeah, that's great. It's a good way to go about it. So I have a question here regarding one of your slides. It says you showed a slide on treating telangiectasia or small vessels around the nose. How easy was that to learn? And do you delegate that procedure in your practice? I know that you've already answered that question and that you do delegate that, but can you talk to us about the learning process of that and how quickly you picked it up or your staff?
Yeah, it's a very the learning curve is almost non-existent. You basically need to see one and try one, and then you can do one. With kind of the pearls starting with the lowest energy necessary. So put it on 1, see if you can get that vessel to blanch, because you're putting some pressure down, and see if it goes away. If not, maybe crank it up to 2 or 3. But it's very easy to learn. But like I said, what you do learn, I guess, when you're treating patients is you do see them back in about 3 or 4 weeks, because you'll see some collateralization or maybe some new vessels pop up or recannulalize, or whatever the mechanism may be. So you'll want to try maybe treat them 1 or 2 more times. But I sell it to them as I sell the patient that. I don't tell them 1 treatment is going to be sufficient. We're going to try to get this in 3. But it's easy to learn, and I do delegate that. Yes, my esthetician performs that on my patients.
Okay, so to clarify, you package it in treatments of 3 that will be performed every 2 weeks?
I'd say I probably see them back in about 3 to 4 weeks.
Okay, all right, great.
Come back, or if anything residual remains.
Okay, very good. Thank you. So I have a question here regarding RF, in general, RF platforms. And how do you compare this one to others? And I guess what made you choose this one versus the others that are out?
Well, number 1, does it work? So yes, it works. I think that that's the most important thing. I don't sell anything to my patients that I haven't tried on myself. So I was very impressed with the results. Number 2, does it hurt? Having something that requires me to do a nerve block to administer any kind of an oral Valium before they come in, or really have to do a lot of hand holding, was not something I was looking at. Something that required me to actually do it was another factor. I'm not really using all my devices, their potential, if I have to physically operate them all, because it's something so intricate or detail-oriented that my esthetician could not perform it. So that was a big factor with me. The thing with these treatments with radiofrequency, if you hurt a patient, they won't come back. So I just told you I like to do at least 3, but ideally 4 to 6 sessions of this. If I sell somebody a package and the first session is miserable, it's painful, it requires anesthetic, it's anything less than awesome, regardless of the results, I'm not going to get them back for the rest of that package and to complete it. So the devices we have tried, I did use something that ultrasound guided. It required me to help identify the nerves, me perhaps to administer BLT or inhalation of nitrous, because it was so unreal for the patient. That was not a good option for my practice, because it required me to physically be there and do it, if that made sense. So delegation was important. All of my team members can use this device is important. The patient comfort level is high, and then patient satisfaction regarding results was high. Those were the 4 things that I looked at, which I think this temperature device blew some of my competitors out of the water.
Okay, very good. Well, it looks as though we're coming to the end of our session here. If you want to advance to the next slide to me, I just want to mention some things to our attendees. We have an excellent clinical support line that we hope that you'll reach out to. We haven't gotten to all your questions, but we're gonna get in touch with you directly with your questions. But if you have anything come to mind after the session's over, please feel free to call And the hours are right here below, and the phone number and the email. And this team has a multitude of years of experience behind them in practices just like yours. So they know the challenges you're facing, and they can answer your clinical questions on this and all the other devices. So please feel free to reach out at any time. And also, Dr. Faramonte, we can't thank you enough for your time today. We appreciate the many Cynosure University students who've joined us throughout this past month. And we just feel very confident in this investment in your education, and this is time well spent. And we appreciate our partnerships with folks like you, Dr. Faramonte, and we're all just going to continue to grow and learn. And we'll see you back here next week, everyone. Bye for now.
Bye.